Why is multi-sectoral TB prevention advocacy difficult? Advocating for tuberculosis prevention is a complex task. Tuberculosis is not just a health issue. It intertwines with social, economic, and environmental factors. This means that effective advocacy requires collaboration across many sectors, including health, labor, housing, and civil society. The challenges are numerous and interconnected. One major difficulty is the complexity of tuberculosis's social determinants. Factors like poverty, undernutrition, and crowded living conditions heavily influence tuberculosis rates. To tackle these issues, we need coordinated efforts that go beyond the health sector. This involves aligning various sectors that often have different priorities and goals, which can be quite challenging. Another issue is the fragmented engagement of stakeholders. For multi-sectoral advocacy to work, everyone involved must have clear roles and shared goals. Unfortunately, there are often gaps in the engagement of non-health sectors and civil society. This lack of meaningful involvement can lead to limited accountability, making it hard to monitor progress effectively. Political commitment and funding are also crucial. Sustained political will is necessary for multi-sectoral tuberculosis efforts to succeed. However, global funding for tuberculosis prevention and care often falls short of targets. National budgets frequently focus only on health sector activities, which limits resources for integrated approaches that involve social protection and occupational health. Organizational and structural barriers further complicate collaboration. Effective multi-sector cooperation relies on having the right organizational structures and a culture that encourages teamwork. Many countries lack these enabling environments, leading to poor coordination and duplication of efforts. Communication gaps and unclear responsibilities can make joint policymaking and implementation even more difficult. Reaching vulnerable and marginalized populations presents another challenge. Tuberculosis disproportionately affects groups such as migrants, prisoners, and ethnic minorities. These populations often face significant barriers to accessing care and social services. Multi-sectoral advocacy needs to address these barriers with tailored approaches and strong community engagement, which can be hard to maintain. Lastly, external crises like political conflicts, pandemics, and climate change can exacerbate tuberculosis risks. These events disrupt health and social services, complicating coordination efforts and diverting attention and resources away from tuberculosis prevention. In summary, multi-sectoral tuberculosis prevention advocacy is difficult due to structural, financial, and political challenges. It requires overcoming barriers to coordinate diverse sectors with differing priorities. Effective advocacy needs robust accountability frameworks, sustained funding, inclusive stakeholder engagement, and adaptive strategies to address the complex social determinants driving the tuberculosis epidemic. Without these elements, advocacy efforts struggle to translate into effective policies and programs.